And it goes a little something like. How can you a summer and after. Welcome to Sumi Huddles. I think this is fifth episode, and today we have Amber Yıldızel with us. I'm going to share a little bit about her, then we're going to hear from her about her journey. So Amber has an extensive background in public health, humanitarian action, and migration studies. She's worked closely with displaced population as asylum seekers. She focuses on mental health, gender-based violence, and health equity. Her research and practice span multiple continents. We love her content on bringing some critical lens to political complexities of humanitarian work. And yeah, hi, Amber, welcome to the show.
Hello, I'm so excited and honored. This is my first podcast, so I am very, very excited and also quite nervous. But thank you for having me.
Yeah, I think it's gonna be fine. I'm nervous too, so every time it happens. No
Always,
worries.
for
Yeah.
some reason, never gets easy. Also, I love her earrings.
Thank you. I just bought them.
Really cool. I wanted to say it before the podcast, but I couldn't say it, so now everybody has to know that you're.
Yeah. All right, so to start, could you tell us a bit about your journey into humanitarian work? What drew you focus to, especially migration, health justice, and public health? And until so far, how has your approach been shaped by your experiences in the field?
So I, from a very young age, have always been interested in working outside of the US. And for me, that comes from the fact that I grew up. I have coined this bicultural. I don't think it's actually a thing, but growing up bicultural. So both of my parents came to the US from Ankara when they were adults. And so I grew up in a very Turkish household in a very American town, suburban New York on Long Island. And so I was always very aware that there was so much to the world outside of the US, and I had the fortune to travel both to Turkey and to other countries as a young child. And so I think that's where my interest in international work comes from, which is not to say that there's not a lot of work that needs to be done in the US, but that's why my primary focus tends to be international or global. And in terms of what drew me into the work I am now, so I studied international relations with a focus on human rights. And I remember during an internship, my manager had asked me to look into health as a human right. And that for me just like unlocked this entire new world. And it was in that moment that I decided that I wanted to do a master's of public health. And so for me, it's really this idea of everybody deserves to have access to healthcare, to be able to make their own decisions about their health, to be healthy and well in the greatest capacity possible. Um, and so, given the international relations background, I ended up really feeling drawn to humanitarianism work. I think especially because, Turkey has obviously been such an important player in the migration that we see that ends up leading into the European Union countries.
Mhm.
But more generally, I think I went too specific first. I am someone who has grown up with immense privilege for which I've always been extremely grateful. And there's this quote that I really like. I have it written down everywhere. It's on my laptop screen. I keep it on my list of quotes. And it's, I can only make sense of my unaccountable good fortune by assuming that it means I am under special obligation to make good use of it. And so this for me is kind of my guiding star, I guess, is like, okay, I've had all these opportunities, I've had all of these privileges, and so what can I do with it? And so for me, it just made sense. It's like, okay, I'm interested in human rights, I'm interested in health, and I can pursue this. And this is a way, me giving back to the world that has given me so much. So yeah, that's kind of the more general way I ended up in this.
Yeah, this remind me of there was some controversy online about Greta Thunberg, and somebody was talking
Mm,
about she was born so privileged, her parents are rich. If I might be misquoting, but and somebody said that's the best way to use your privilege, then
yeah.
use your generational wealth for good, for humanity, and that remind me of
Yeah.
your story.
It's definitely something that I can relate to. I think perhaps it's the way we're raised. Perhaps it's just the way we are. I don't know, if nature or nurture. But yeah, I feel immense pressure on myself, which is not to complain. I think I should have this pressure on myself to, at least do something good to give back.
Yeah.
It is good to be aware of these things. It is also, I think it shows a lot of empathy with which a lot of humanitarian activists, workers that we talk with have. It's a double-edged sword. We had some episodes about like managing that
Yeah.
stress and awareness as well. So I think I will also want to go into a little bit more into the activist, the humanitarian worker part of this issue. I'm sure you're aware that these issues are incredibly intricate and they're very political, obviously. And I noted down another quote that I think always leads to a lot of interesting debate, which is there are no humanitarian solutions to political problems, some say. For example, we've talked about Greta Thunberg and
Mhm.
activists trying to reach Gaza and provide aid to Gaza, where there had been very political, bureaucratic, structural barriers that limit their work, basically. And I was wondering, what do you think? How should we understand that balance, the limits of humanitarian activists in situations where political paralysis happens and there's obstruction to meaningful action?
That's such an interesting question and definitely a very complicated one. I've learned about, humanitarianism and the four humanitarian principles in so many different contexts. And I can really only think of one professor who really questioned that and encouraged us to question it. And just to give a little bit of context for anyone who doesn't know the principles, it's humanity, impartiality, neutrality, and independence. And I would say that when we get into the political nature of things, the two that I tend to critique the most are neutrality, which is the idea that humanitarian actors shouldn't take sides, shouldn't be partial to, any side or any group. And then independence, which is that humanitarian objectives should be autonomous from political, military, geopolitical objectives. I think my first thought is, when people think of humanitarianism, oftentimes they think of the UN and its different branches. The UN is made up of and funded by states. So that to me has always been a very interesting uh, oversight, let's say, of, oh, humanitarianism is independent from governments and independent from states. And it's like, where does your money come from? Who agrees to give you money? And I mean, we see that right now with the US saying it's not going to fund the UN anymore, and with other countries as well cutting their budgets. And that is, of course, going to impact the humanitarian work that the UN branches do. I think for me, the best example of how no humanitarian crisis can be apolitical in its nature or in its resolution is looking at famines. And there's a great book that I read for class in undergrad by Alex DeWall called Famine Crimes. And the idea is a famine is not a natural disaster. A famine is perhaps kicked off by an environmental event. But if we look at famines, for example, like Sudan, Ethiopia, Gaza, there are ways to prevent or to mitigate. And it is the duty of a state to take care of its people. And so by not doing so, that is a political choice. I understand why for so long there's been a push to keep humanitarianism apolitical. One of the biggest arguments to keep it apolitical is that it will help increase access, will make sure that, more humanitarian aid can get in, can be distributed, because, states aren't going to be worried, or non-state actors, I suppose, aren't going to be worried that, humanitarian actors are going to come in and have other plans, I suppose. But I think time and time again, we've seen that to not be true. Humanitarian actors in many different settings are targeted in conflict, which I would say is a political act in and of itself, in a way, and is certainly not a neutral act. But to be honest, I don't know if I have thought of a way to make humanitarianism political and still possible. Humanitarianism has grown a lot. It's just become so many things at once, and it's, I think, really creeping into things that would be normally counted as, let's say, like development. I think humanitarianism needs to be viewed as the immediate response to mitigate, protect, alleviate, while long-term solutions are being constructed. Because no amount of aid is ever going to be sustainable when it comes to rebuilding or coming up with better infrastructure. Like infrastructure is a great example. Humanitarian aid can't really build infrastructure that's going to last. That's not what it's supposed to be. But we're also seeing really prolonged conflicts, which again gets into like humanitarianism growing into something far more than an immediate solution. I think it's a hard time to argue that humanitarianism should be political because it is so politicized at the moment and so controversial. But I think long term, as we work towards a better field of it, the idea that it should just be kind of the immediate solution while working on longer term beneficial impacts.
I definitely can see this even in our own work. It's a decision that you need to make. A lot of it also, as you mentioned, comes to funding, and there is public funding available and possible, and crowdfunding possible, but the bigger changes usually require some more structural funding that usually comes from states or other political actors.
Yeah.
So it becomes a very interesting issue, and I'm sure it was a very hard question. Even when I was asking it, I was like, oh, this is too much. But I think your answer was really good, a good overall understanding. I feel more confident, at least.
Talking about these contradictions in humanitarianism, I think we're not done with them yet. I wanted to talk about being a humanitarian worker. You're witnessing an immense suffering, and in the day you get these moments of privilege and or leisure. And I think these can create, some defensiveness, maybe some guilt or denial in humanitarian workers. So how do you think they should manage, or the system that they're in can manage this discomfort where it doesn't paralyze action, but that informs maybe more ethical and reflective practice?
That is a great question. Definitely a hard one. I think for many people, ability to work in humanitarianism of your own volition is in and of itself a privilege. You get to decide if this is what you want to do as a career. You get to decide if you want to go to a certain setting or not. You get to leave. Once you're there in that setting, you're often afforded privileges that uh, local communities are not. And so it's definitely very intertwined. Privilege is very intertwined with everything about humanitarianism, in my opinion. That being said, I think there are aspects of being a humanitarian worker, being involved in humanitarianism, that can be quite difficult, even if you are not yourself involved directly, like, vicarious trauma to certain degrees, burnout. Like we see a lot of these things. I think Sue's point of empathy being a double-edged sword is something I think about a lot. I think it's so important, and I think it can also be quite draining. I guess I like to summarize this inherent contradiction of privilege and suffering is so one of my most impactful life experiences, professional experiences, was when I spent 3 months on the island of Samos working for a humanitarian organization. And I'll touch back on them a little bit later because I love them. But we were on an island. We were on an island where people go to vacation. We were working long days, definitely, in would hear a lot of difficult cases and got to interact with and support people who were living in the camp on the island, which is truly like a prison. And then at the end of the day or on the weekends, we would go swimming in the Mediterranean. And a few weeks into my time there, there was a huge shipwreck. Not super close to the island that I was on, but close enough. 600, 700 migrant lives were lost. And I remember that really got me thinking, was like, this is a paradise and also a graveyard. And I don't think that means that we shouldn't enjoy it, but it is an important thought, at least for me, an important reflection to hold on to be aware of positionality and aware of privilege and benefit. I think sometimes for me that does slip into the paralysis of feeling guilty, especially over like the past 2 years. And I can't say I have an answer for that just yet. But the one concept that I've tried to remind myself of is the notion that comes from, airplane safety of in case of an emergency, put on your air mask first before helping others. And I do think also, in addition to that idea of, making sure that you have enough air, you have enough energy to give, it's also the idea of collective care and the idea that we're not alone. And this is big in activism. And I would not claim to be an activist by any means, but this idea that like the best way to keep activism going is for activists to help take care of each other and rely on each other. And I think within humanitarianism, we could use a bit more of that collective mentality of, we're all here together to remind each other of our privileges and to be there for each other when someone's experiencing burnout or when someone's really struggling with, separating themselves from the work they do each day. I think we need to accept that humanitarianism can be a very consuming thing to do. And so that idea of you can have support amongst the people you work with, and they shouldn't be your only support, but you can't run away from the uncomfortable parts of your job, which might be the pain that you hear that other people have experienced, the suffering, which might be the guilt you're feeling because you're privileged. So I think normalizing talking about those things in a way that's not accusatory. And that might be having conversations like this with a few other people. It might be having that like built into onboarding, having that built into team meetings, things like that. Because it is very important to be aware and to also be there for each other when we're working.
I think more and more we see humanity and more care and more love being interwoven in it, which really helps. Can also be very intimidating for people to get into, take the first step to take some action. So I think it's a good thing. You talked about how your parents have migrated to US, and I'm currently in Netherlands. I consider myself an immigrant, and I always try to have these conversations with people, not only because I'm curious from a humanitarian perspective, but I'm also curious about people's different understandings. Because there is this increasing dialogue and discourse about having, migrancy or
Mhm.
migrants being threats. And I really like talking to other people about this. And since you're, working on it, you have some personal, I'm sure, experience or understanding of it. From a more like a humanly perspective, I'm asking this really. How do you yourself interpret, especially the situation in the US? What do you think that sparks these issues? Because this is a big question, I know, but I'm curious about your perspective. Do you think this is an irrational fear, or it's something that's in the making, or it's a political strategy? Are people, or people more, oppressed by some complex social structural patterns that sort of manifest in this hatred? Do you have any idea, any perspective that you'd like to share with us on that?
I feel like that could be an entire doctorate thesis.
Yeah.
And I'm sure someone has written it actually, and I'm sure it's excellent. From my perspective, I think it's a combination of things. I think there is, let's say, this political strategy of creating scapegoats, of creating the other, of the them, so that you can strengthen the us. I think people feel the need maybe to feel superior. And for example, I was reading a paper that my friend sent about how there's a lot of anti-migrant rhetoric amongst the children and grandchildren of migrants
Mm.
because it's like, well, my family did it legally. My family did it this way. And then this idea of you want to be able to look better. You want to be able to elevate yourself. You want to be, I guess, closer to the privileged classes. And I think there is also definitely an aspect of fear, the fear of the unknown, the unfamiliar, which is absolutely intentionally worsened by politicians and media. Because when you have never really interacted with anyone different from you, or you've never met someone who is not like the stereotypes you impose on them, you're not really going to have any basis to push back and be like, no, I don't think that's true. Or like, oh, I feel like the media is maybe like pushing this one narrative too much. What I've seen is being able to talk about the people I've met as people has been very helpful. I have quite a few people that I met on Samos who were then able to leave Greece, who, are asylum seekers or refugees, who I'm very lucky and privileged to call my friends. And, being able to have people in my life meet them or be able to talk about them as my friends, I think helps make a difference. And I've definitely used anecdotes when I'm in Turkey and someone's like, oh, Middle Eastern migrants. And I'm like, well, actually, which, that could be a whole other podcast episode, ama neyse. I think humanizing humans is very important. I believe that as human beings, we do much better with the people that we know, that we're close to, that we can talk to. It's easier to have empathy, I think, for most people, for someone that they know. It's easier to be empathetic towards a neighbor than it is to be empathetic towards someone whose face you don't know, whose name you don't know, whose story you don't know, in a country that you probably can't point to on a map. But also, I think there's a thin line between humanizing and exploiting people's stories. And on the more like visual side, posting pictures of people, posting videos of people, like when does that get to be trauma porn, which is another issue we have in humanitarianism. But for me personally, the ability to have met asylum seekers and refugees in various settings, and especially when they feel comfortable enough to share some of their story with me, or to tell me about, their families, their hobbies, things like that. I really do count that as a privilege because it's an opportunity I know that so many other people don't get, but I wish they could because I think it would make a difference in this growing, rapidly, steadily growing, like anti-migrant rhetoric.
Yeah, I mean, I also really want to ask you about your specific subject, which is, I think, more on healthcare and also bodily autonomy. When we talk about, migrants in certain states, we see, for example, women and children having compounded issues when it comes to healthcare and bodily autonomy. And I'm also wondering what you think of this whole, migrancy as a threat narrative and how it connects to access to healthcare for these people. Because you also talked about, humanizing them and really understanding them as human beings with same needs and wants as we are, and more importantly, the same rights as we are. And I wonder what you think about that from that perspective as well.
Based on, what I've seen, uh, migrants, whether they be undocumented migrants in the US or asylum seekers and refugees, In Europe, healthcare is difficult for them to access. Sometimes there is really no pathway built in. Sometimes the care that's provided is just bad. Because if a government doesn't want displaced people in its country, it's not going to give them good health care. That's very intentional, unfortunately. I think also there's so many levels of health. There's, of course, physical health. For example, in Greece, when pushbacks happen, those are often very physically difficult. It's a type of assault, so people might have injuries from that. People might have chronic conditions that have been worsened during their journey to wherever they're ending up. People might develop chronic conditions because of their migratory route and how long it is. And then there's, of course, mental health and the trauma that comes from your situation. But I would also argue the collective trauma that is a result of seeing your community, seeing your society, seeing your culture fall apart. And, that applies to different places. I think in general, that holistic approach to health is quite difficult. And I would say that, for example, like the US healthcare system, not very holistic, even towards citizens with private health insurance. I think oftentimes health, especially things like mental health and chronic health conditions, or things like sexual and reproductive health, are, I don't want to say deprioritized, but if an immediate crisis happens, they're not top of mind. It is going to be things like, I don't know, setting bones, giving stitches, wrapping bandages, things like that. But I think sometimes that mindset is continued even in prolonged conflicts and humanitarian crises. Health is a human right at every stage of life. Everyone deserves to be able to make health choices for themselves. And a big one that is more in my wheelhouse is the idea of like sexual and reproductive health. It doesn't matter if, a woman is living in a refugee camp in a different country. She should be able to make decisions about her sexual and reproductive health, whether that be to use or not use birth control, what type of birth control to use if she so wishes, prenatal, postnatal care, childbirth in a clinic at home. I think a lot of times, especially when men are running humanitarianism practices, those types of things tend to be forgotten. Or even like making sure there's access to like menstrual products in a way that's culturally sensitive. I think those things get forgotten because they're not maybe experienced by an entire population and they're not necessarily as visible as something like broken bones or someone needing surgery, amputations, which is not to say that those conditions aren't incredibly important and need to be addressed quickly. The idea that like all health matters and all health should be addressed, even if it's not immediately, if that makes sense.
Talking about menstrual products, I remember the earthquake that happened almost 2 years ago in Turkey, especially in Hatay. After the disaster happened, I saw that women didn't have access to any menstrual products. It's sort of like an afterthought.
Yeah, exactly.
And I actually wanted to dive a little more into the gender side of the issue, which you briefly touched upon. But maybe we can go a little bit deeper and talk about like the most urgent health inequities affecting migrant women. Maybe in your experience working with migrants and asylum seekers, how can we make sure that these systems are designed to uphold autonomy
Mm.
and dignity and justice? Because, like you said, you do immediate response, but then there should be systems behind that supported in the long term. How do you with that?
So I will say that most of my experience working with migrants, which I guess is mostly in Greece, has been with men,
Mhm.
but my academic focus has often been women and girls. And then there's also a very important category that I know far less about of queer, gender non-conforming migrants, refugees, asylum seekers, etc., who have unfortunately their own set of problems. I think especially when it comes to things like sexual and reproductive health. But I think often when we talk about health for women who have been forcibly displaced or who have left, etc. I don't think the view is intersectional enough. And by that, I mean, yes, these women are migrants, refugees, asylum seekers, but they're also women and girls, and they're also part of their culture and their society, their mothers, their daughters. There's the gender roles and expectations that they face. And so, without taking into view all of the aspects that are impacting somebody's health and how those aspects change in different settings, it's very difficult, I think, to come up with a system that is actually going to address health properly. Generally, my go-to answer for honestly everything related to humanitarianism is ask the population. This, I think, is becoming more and more popular, I hope. But I think the idea of as we move away from the white savior complex, the Western savior idea that we like to pretend isn't in humanitarianism, but oftentimes is, at least in the context that I'm in. People know what they need. I am never going to be able to go somewhere and be like, oh, this is what you need. I mean, even like using the example of the earthquake in Turkey, I'm, a Turkish woman, but I would not be able to go to Hatay, the villages, and be like, oh, well, what these women need is this. No, I don't know that. I wasn't there. I don't live there. And so prioritizing, I think not even prioritizing, requiring there to be ways to really get in touch with communities and find out what they need and what they want is super important because sometimes one organization might say like, oh, well, these women need IUDs. And in reality, they might need, I don't know, honestly, like food or medication, or they might view IUDs as invasive, as against their cultural practices, and it's not our place to tell them that's wrong. It's our place to give them support, and with that can come education in case they do want to change their decisions. But really, just the idea that when it comes to humanitarianism, when it comes to any kind of aid, the people on the ground know what they need best. And I think especially for health, that is really important and perhaps not as obvious as I would like it to be.
Mhm. That made me think about how women that are not migrants or not in an ongoing conflict, when you go to a hospital or practitioner, sometimes you're not listened to. Your
Hmm.
needs are neglected, and we see this in the US, especially with African American women
Yep,
whose, access to healthcare, and or when they access it, they're not listened to and they're disregarded, which can cause death. And I hope we can, I hope not, but I think we should, yeah, like you said, required in this context, and also hope that it reflects on the humanitarian side of things as well.
definitely.
I wanted to actually ask our sort of closing question that we have.
Okay.
But before that, I want to add a small question because you've been talking about, your experience in Samos and how it impacted you. And I think a lot of your answers, come from that experience as well. But I want to know more about it, and I'm sure people listening would like to know more about it. I want to ask, what were your role there, and what did you take away, not just as a humanitarian worker, but as a person from that experience? I want to know a little bit more about that before closing, if that's okay.
Yeah, of course. So as part of my master's degree, we had to spend a certain amount of time, I don't remember how many hours, doing what we call a practicum, kind of like an internship of sorts. And I knew, again, that my interest was in forcibly displaced populations who ended up in Europe. I had to really fight for this because, at least at my school, it's not humanitarianism unless you're like in Africa. Maybe parts of South America and like maybe some parts of Asia, mostly Bangladesh. So I was like, I want to to go to like the hotspot islands in Greece. And they were like, what are you talking about? And I was like, oh, okay, this is going to be a long talk. So I ended up finding an organization called Self Made that is located in Samos. And so it was founded by some Swiss people who now live there. And their specific location in Samos is called Skills Factory. And part of the reason I loved Skills so much was it really helped me start to see how to bring the idea of like refugees are not just refugees, they're people first to life. Because Skills Factory's thing is making what you need yourself. And so this idea of people might come in who, for example, were tailors back home, were chefs back home, also things like vets and doctors, but just like thinking about the scope of skills. And so, for example, we would have different departments, and so someone might come in and like teach other people how to sew. And so that way, let's say their clothes rip, they can fix it themselves, or like people from the camp would come and like have free alterations, free repairs done. Actually, someone who's like one of the heads of the organization now fled Gaza a few years ago, and he is amazing with electronics. Like he fixes, I don't know how he does it. He like fixes cell phones all the time, and he's taught so many other of his peers to also be able to do this. And that's a great way internally and maybe for mental health, arguably, of like, oh, I can learn something, I can do something, I can do something with my hands. But I think also really pushes back against the very widespread narrative of migrants are just here to take and they're poor, so they need our resources. And like, why are my tax dollars going towards that? And it's like, no, like these people are skilled and smart and know all of these things in their own ways. And so it was really nice to see that. And I think also just the way that like people, everyone at Skills was great. And like the sense of community. There's this one instance where I ripped my pants riding a bike and I was like sitting at the desk trying to hand sew it. And one of the guys who had left Sudan, was seeking asylum in Europe, was like, Amber, give me that. And then just like went over to the sewing machine and sewed it. And I was like, wow, I don't know how to use a sewing machine. You just saved me like 30 minutes of hand sewing. And so every time I wear those pants, I still think of him. Like things like that. I think that really subverts this very flawed notion of I, as the well-educated, American, I'm going and I'm going to teach things. And it's like, no, I didn't teach them anything. I learned so much from them. And I gained so much from them. It was just a good experience. But I will say that was an unpaid position. I got free housing, which was great, and I got lunch every day. But everything else, like my tickets, my daily labor, none of that was paid for. And so like being able to do that 3-month position was in and of itself a privilege, for which I'm eternally grateful. But just tying it back to the beginning of the conversation about humanitarianism and privilege. For me, the experience was an affirmation that I wanted to continue doing this kind of work. I don't really feel as if I'm a humanitarian worker at the moment. I would like to be in the future, but I really enjoyed getting to work with people, like being on the ground, and I wasn't giving medical care or I wasn't building anything, but still feeling like I was able to provide some sort of support, even if that was just as a friend, as someone to talk to, someone, to like practice languages with. That was really important for me. And it actually did help motivate me to finish my master's, because that was after my first year. And very early on into my second year was when we saw the increased siege on Gaza. And I felt very frustrated and lost. And I was like, I'm learning in school about humanitarianism. I want to actually be doing something. Like, what good is this? What good is me sitting in a classroom talking about this? So many people were like, you have to get through this so that you can then do the work you want to do. And so I actually, on my graduation cap in English and in Arabic, wrote for my Habibis, because they're the people I met that summer, and what they represented and what they gave me and gifted me were that's what got me through that second year of being like, okay, I'm doing this for a reason and it'll pay off in the future. And so I don't really know. I think my second year would have been a lot harder to get through without being like, there are people who I care about, who care about me, who believe in me. And so I want, again, to use my privilege to do something and to kind of give back what I've gained. I tried to take a picture with my cap, but you can't really see it because of the angle. So people were like, Amber, what are you doing? But I knew it was there. I knew in my heart, and like I have it, I had it on a piece of paper.
I think we all need like sometimes some people or some circumstances to carry us to the
Yeah.
next step. And it's totally normal to depend on that. I'm glad that you had this experience because now we're talking about this.
Yes.
Even that is a good step, I think. And I want because now we talked about our past, and I feel content that I know about that. I can peacefully come to our closing question, which is about current Amber and perhaps the future. And we like to ask the final question about like what is something it's a if it's a particular issue or a project that you're working on, that something that you're currently very fired up about and passionate about. It can, I always say it can even be a neighborhood brawl. Like it doesn't have to be anything specifically to do with what we've talked, but something that you're really passionate about right now.
I'm always passionate about Skills Factory. Everyone should go check them out on Instagram. I also recently volunteered for an organization in the UK called Migrant Connections, which just had their festival last month, which, like the entire festival, is about celebrating the diversity and culture of different migrant groups in London. Closer to home, something that's been quite helpful is I've been volunteering with an organization in Manhattan called Evie Loves. And they started off during COVID doing food distribution, and it's grown now. I think it's like every week they distribute maybe like 2,000, 3,000 meals. And so on Sundays, most Sundays, I am part of the team that helps actually distribute the food. And it, in a way, reminds me of Skills Factory because it very much gives me the chance to interact with people. And I am an outgoing introvert. So I really like being around people. And then I'm like, okay, no one talked to me for a few hours. I'm done. But yeah, volunteering with Evie Loves has been great because it gets me, one, out of my apartment, two, away from my desk because I work remotely. So I'm just staring at a computer all day. And three, just with different types of people, people that I didn't go to school with, people that I'm not friends with through work or family or whatever. Um, so I think that's great. I think my general thing would be if you have the time and the energy to volunteer, particularly in person, definitely do it. I wish I had started earlier, for sure. Besides that, I'm excited about what young people will bring, like my peers, those younger than me, those a little bit older than me, who are so impassioned and intelligent and empathetic. It's been a very strange time to be alive. I like to call this the cursed timeline that I didn't ask for. And I am not actually doing that poorly during it, but I'm looking forward to seeing like when we get older and we start to be able to take positions of power and we start to control, the funding and the organizations, like what that's is going to look like. So not a super definite answer, but yeah.
No, I think it actually made me think of something that I wanted to tell Umay as well, and now that you're here. I just recently saw that like some kids on Roblox had a little march on Roblox, like online march for Gaza.
I love
And
that.
like Palestine flags and their little like cube mans just marching. I was like, this people are amazing and
Yeah.
amazing. And yeah, there's a lot that's interesting and hard to deal with, but there's also a lot of creative ways that people come up to deal with it. So it's always
Yes.
to look forward to those at least. And I want to thank you so much for being with us. It's my first time talking to you face to face, but it was incredible. You have such a nice energy and
Thank you.
lovely to learn from your experiences. And I hope to keep in touch. And I hope that everybody who listened to you had taken away something that's insightful and inspiring from this conversation, because I did.
Thank you so much.
Thank you, Amber.
I just wanted to say the questions you guys asked were great, and I am now like, should I start writing again? Should I be writing essays to these questions? Like, I'm so fired up about them because it's just nice to like be able to think about it and talk about it. So thank you for having me on the podcast, and thank you for asking such thought-provoking and insightful questions.
Oh, thank you so much. Yeah, it was great listening to you.